Hi, my name is Dr. Annette Bosworth, and I'm back again talking about ketones and the benefits. Today, we're going to tackle PCOS and libido. PCOS stands for polycystic ovarian disease, and if you have it, you probably know what those letters mean. I warn patients going on a ketogenic diet that this diet boosts hormones. One telltale sign of a hormone surge in a woman is menstruation. If you're a woman of childbearing age and you're headed on to a ketogenic diet, be prepared for a change in how you menstruate. When women switch to a ketogenic diet, this new diet, high in fat, is high in nutrients as well. And you can be warned that this surge in hormones changes how they feel, how their sex drive works, and how their body loses weight. Estrogen reigns as the greatest female sex hormone. It's the most abundant and is usually found from a source of ovaries, the adrenal glands, and fat. Yep, that's right. You get estrogen from extra fat. If you have a lean body, you'll have most of the estrogen coming from your ovaries and a little bit from your adrenal glands and hardly any from fat. You add 20 to 30 pounds of fat cells and now your most abundant estrogen comes from your fat. What's the difference between fat-produced estrogen and ovary-produced estrogen? Chemically, they're identical. The problem comes with how they listen to feedback. If your estrogen comes mostly from your ovaries, your body listens. It will change the amount of estrogen that you produce when you're having a period, when you're pregnant, when your mind is working well, when you're well-nourished or poorly nourished. The body responds. If most of your estrogen comes from fat cells, they don't listen to anybody. They just produce fat. The more cells you have, the more estrogen you produce. And that becomes the steady, stable delivery of estrogen. Fat cells leading the production of estrogen, that's PCOS. One of the blood tests that we can use to check for PCOS is we find an abundance in male hormones. This excess male hormone coursing through the veins of a woman causes irregular periods, really bad acne, and some moodiness that is also accompanied with hair growth that looks like a boy. You'll find it on their chin and even around their nipples. This is because of that extra boy hormone floating in their blood. And there's nothing that ruins libido for a woman more than boy hormones floating around their system. Ketosis boosts estrogen, whether you're overweight or not overweight. It's complicated to explain what it does in a patient with PCOS. So let's start with somebody who's not got PCOS and they go on a ketogenic diet. That woman notices about 10 days after going keto that she might have a period. The hormones inside her body surge and her body responds with menstruation. After 3 to 4 weeks of eating keto, you'll find these women sleeping better, a more stable mood, and an increased libido. Patient after patient brings this up. It's usually behind the closed doors of a doctor-patient relationship, but it's something that is so common that I feel the need to educate about it. You see, when you add fat to your diet, you increase a bunch of hormones called steroid-type hormones. These include estrogen, testosterone, cortisol, and aldosterone. All of them are based out of a chemical that is a cholesterol. Again, a fat. The process of increasing your fat increases all of these hormones, which in turn improve your libido. If you suffer from lower hormones and you go on a ketogenic diet, you will indeed increase those hormones. But I contend that sex drive is improved for a different reason as well. Ketosis improves the overall brain function. Orgasms happen in your brain. And when your brain is not getting proper nourishment and rest, it doesn't work right. It goes slightly swollen when you go without sleep and without proper nourishment. If this happens for a day or two, you don't really notice. But years of poor sleep and poor nourishment, often found in a low-fat diet, and you find women depressed with a low libido. Return this nourishment to their diet and see what happens. So for this non-PCOS patient, this normal lean woman going on ketosis, you'll often find her feeling dramatically better with better rest, better mood in a week or two. Now let's go to the PCOS patient. And this is more complicated. I contend, though, that the best treatment for PCOS is a ketogenic diet. Long-standing elevated insulin is the core problem for PCOS. It's the same chemistry that's happening in a type 2 diabetic. They are very similar. Pushing the insulin down to a normal level is the only way to make PCOS go away. We use medications to try and help with this, But nothing works as well as lowering the carbohydrates and shifting the chemistry from the inside out. Unfortunately, if you have PCOS and you go on a ketogenic diet, and you read on the internet that if you do this, you're gonna have great sex drive in a couple of weeks, that's not you. You're gonna take a lot longer to heal some of the problems. I will contend that you will feel better in 10 days, but you're not gonna have the improved brain function just yet. Let's walk through this. A PCOS patient goes on a ketogenic diet and they do lose weight. They'll drop 20, 30 pounds over the course of those first 6 weeks. And then they usually plateau. After a few weeks of that scale not moving, they're back in my office saying, "Hey doc, what's the matter? Why won't I lose weight?" I teach them the answer by having them check their finger stick blood sugars first thing in the morning. One prick of their finger for 5 days in a row, and they often can tell me the truth about what's going on inside their body. Frequently, I find their sugars are between the 95 and 110 range. This is not bad compared to where they were 6 weeks ago. And indeed, because they've lowered their blood sugars to that level, their body lost weight. But now they've reset at a new normal. Those blood sugars between 95 and 110 still stimulate the production of insulin. And where there's insulin, especially in a PCOS patient, you lock down fat cells. Locked fat cells mean no weight loss. For years, these PCOS patients have had an abundant response of insulin every time their system sees sugar. In fact, it's in that mismatch of too much insulin produced for the sugar that makes their sugars go low. They'll often come in early in their disease saying, "Doc, I get hypo." And what they mean is hypoglycemic. They get low blood sugars. This is because their body accidentally makes a whole bunch of insulin. For them to reverse the chemistry, they have to keep the carbs low. So they come in 6 weeks into a ketogenic diet and they are following the rules. They don't eat more than 20 carbs a day. Their body has made some significant improvements, but they're stalled. And the reason usually is they continue to eat in a pattern that is what they've always done, meaning they usually are eating 3 and sometimes 5 times a day. Now, don't get me wrong, they're high-fat foods. They aren't adding more than 20 carbs a day, but that high-fat food multiple times a day in a PCOS patient still stimulates the production of insulin enough to lock down their fat cells. These people get then treated with fasting. No, that's not a cuss word. I did say the word fasting. We start out by saying you get to eat 1 hour of every day. 23 hours you spend drinking calorie-free drinks, and 1 hour of the day is all you get to eat. This is the key to getting to the next level for my PCOS patients, especially because of excessive insulin production every time they eat. Sure enough, 1 meal a day usually results in those sugars sinking down into the 80s or hopefully even into the 70s. If they've had PCOS for several decades, I have had to push them into even a longer fast, which is closer to 36 hours, maybe even 48. I do recommend that if you're doing that, you should be followed by a physician. Not everybody needs to be followed by a physician when they fast, but if you have PCOS, I highly recommend it. Your success will depend on it. So here we are. Fasting patients, PCOS, those sugars sink into the 70s and 80s, bam, the fat cells open up again and they go back to losing weight. They'll monitor those morning fasting blood sugars because it's how they can predict if they're losing weight. They keep their sugars low and they are able to lose weight. PCOS affects many of my patients. We don't even get to talk about libido problems when they come in because there are so many other more important things that need to be taken care of in their situation. They aren't the lucky ones who go on to a ketogenic diet and have an improved sex drive 10 to 14 days into this. But once they start following their blood sugars and they keep them in the 70s and 80s, before long, they enjoy better energy, a more stable mood, continued weight loss, and eventually the best orgasm in years. I hope you've enjoyed this. If you want to know more about this ketogenic diet, take a look at the book I wrote any way you can. You can find it on Amazon or on Audible. Until next time.